Good afternoon all. I am Dr. Aparna Krishnan. As we all know, abnormal action potentials can lead to the development of amblyopia, and patching is the most widely advised and most followed treatment for amblyopia, even though it shows only 70 to 75% improvement. So there is a need for other modalities to develop to treat amblyopia. So how Orthoptek Magnocellular is different? It causes repeated foveal fixation by targeted movement, repeated visual cortex stimulation, and it uses saccadic movement and attention mechanism. Saccades, as we all know, are short, fast eye movements lasting for 50 to 80 milliseconds, and it causes posterior parietal and lateral visual cortex stimulation. We use two mechanisms of attention: overt attention, where the eye moves to the peripheral stimulus to ensure foveal fixation, and covert attention, where the patient fixes on the central light and can still see the peripheral lights. These two mechanisms stimulate the occipital, parietal, and the frontal cortex. So whenever there is a sudden appearance of light, there is stimulation of the magnocellular pathway, which leads to the generation of a saccadic movement. So it will lead to the stimulation of saccadic movement and attention mechanism, which is associated with stimulation of the fovea and the visual cortex. When this occurs repeatedly, there is repeated stimulation of fovea and the visual cortex. So we decided to study the effect of Orthoptek on our population, and we conducted a prospective study on a time period between March 2022 to March 2023. And we included all types of amblyopia patients with an age group of more than 5 years of age and with the visual acuity in the worst eye more than or equal to 6/60, and intermittent exotropia patients with a Newman-Castle score between 3 to 4. So how to do this procedure? So it consists of 2 sessions. For each session, the good eye is patched for 20 minutes, followed by amblyopic eye for 5 minutes, and then with both eyes open for 5 minutes. So the first session, as we are seeing in the picture, the child is placed in front of the screen. The screen consists of a red light in the central, which is surrounded by white LED lights. So first, the patient is asked to point to the light on the screen with a pointer, which stimulates the overt activation. And the second session, that the patient will focus on the red light and count the peripheral lights that switch on continuously. And this stimulates the covert attention. So these 2 sessions are repeated after 1 hour, then daily for 10 days or twice a day for 5 days. After 10 sessions are completed, we analyze the visual acuity, PBCT, stereopsis, and BSV. And if there is improvement, the patient will be going to the tapering dose. And if no improvement, we will be stopping the treatment. So we did study in 110 patients, 90 patients of various types of amblyopia, and 10 patients of intermittent exotropia. And the mean age was 10.87, ranging from 5 to 25 years, and 52% of females and 48% males. As from the chart, we can see that majority, the anisometropic, strabismic, and ametropic amblyopia patient showed an improvement more than 73%, and we could see that there was an 80%, more than 80% improvement in anisometropic and strabismic amblyopia patients. And all of the patients who showed the improvement showed the improvement in at least two-line improvement in the logMAR chart, with a maximum of 15 letters in anisometropic and ametropic and 13 letters in strabismic amblyopia patients. In the intermittent exotropia patient, we noticed that the NCS score of 3 to 4 improved to NCS score of less than 2 after the treatment, and 6 patients showed improvement in stereopsis. So we all know that these are the main methodologies which we follow for amblyopia therapy, but Motor study has found that average concordance with patching was 48%, and more than 80% of the improvement during occlusion occurred in 6 weeks. That is where OMS is different, because patching has very side effects such as poor compliance, strained parent-child relation, longer time for improvement, difficulty with day-to-day activities, and it is time-consuming for parents. So OMS use both monocular and binocular during the treatment, faster improvement in 10 days, happy parents, and therefore better compliance. So we are comparing our study to a study published in IGO by Sandan Gopal et al., where he studied 35 patients and we have compared 110 patients. Anisometropic and strabismic amblyopia were studied in his study, and we included all types of amblyopia and IXT patient, and we got comparable improvement in anisometropic and strabismic amblyopia of 80%, similar to his study, and in both studies, no regression was noticed in the follow-up. So possible causes of failure could be dense amblyopia, long-standing amblyopia, older the age group, and discontinuity in treatment. So our study, it is the largest study population where all types of amblyopia were studied and studied the utility in IXT and more promising results in anisometropic and strabismic amblyopia. So to conclude, OMS is excellent results in shorter period of time, and it gives excellent result in anisometropic and strabismic amblyopia, and we can obviate the need for an immediate surgical intervention in IXT. Thank you.
Thank you so much. So you had better outcomes in children up to 11 years of age then, in that case?
Majority up to 11 years of age, madam. As age was more, we had 25 years of age patient also,
Yes.
but they didn't show much improvement.
Right.
We noticed up to 11 years, we had more improvement.
Okay, and what about the level of amblyopia for dense versus mild, moderate?
Actually, 2 to 3 patients had a dense amblyopia. We didn't get much improvement with dense amblyopia patients. The dense and longer duration, we didn't get much improvement.
Sure. Even if they were younger, much younger, less than
No,
4 or
no,
less
ma'am.
than 3?
No.
Okay, thank you.
Anything, just
Neural plasticity. Now you are claiming 11 years, 30 and some more times. What about the old neural plasticity theory? Have you heard of neural plasticity
Yeah, yes,
theory? What is that?
Up to now they are claiming even up to 20 years of age, the plasticity connections can develop. We can try amblyopia therapy even after 12 years of age.
Oh, that's why I'm saying, no, that was the 100 months. So what is now status? Have you gone through any literature of this? Or how can you say this is only on the brain level? Or is it on the corneal level? Okay, fine.
No, till now we haven't noticed any regression. 45 patients had 1 year follow-up. Mean follow-up is 6 months, madam. We didn't notice any recurrence.